Diabetic ketoacidosis is a complication in which your body produces high levels of blood acids called ketones. The condition arises when a person cannot produce enough insulin. As you now know, insulin plays a key role in allowing glucose to enter the cell. Without enough insulin, your body will begin to break down fat for fuel. This process produces a buildup of acids in the bloodstream called ketones, eventually leading to diabetic ketoacidosis. If this buildup of acids persists for too long, you may fall into a DKA-induced coma. Some of the symptoms include frequent urination, nausea and vomiting, abdominal pain, weakness or fatigue, shortness of breath, fruity scented breath, and confusion. For DKA, you may be treated in a hospital. You will first be given fluid replacement. This is to rehydrate you due to excessive urination and to dilute excess sugar in your blood. You may then be given new electrolytes in a process called electrolyte replacement. The absence of insulin may reduce your electrolytes, used to carry an electrical charge through the blood. Finally, you will be treated with insulin therapy, which will reverse the effects of DKA. A hypersmolar, hyperglycemic, non-ketonic coma is caused by diabetic hyperglycemic hypersmolar syndrome. This is caused by extreme high blood sugar levels, over 600 milligrams per deciliters, without the presence of ketones and extreme cases of dehydration. This mostly occurs in people with uncontrolled type 2 diabetes, but it can also be brought on by infection, heart attack, stroke, medicines that decrease the amount of insulin in the body, and medicines that increase fluid loss. Untreated HHN can lead to shock, blood clot formation, brain swelling, increase of blood acid levels, and HHN coma. Symptoms of this are increased thirst and urination, weakness, nausea, weight loss, dry mouth, fever, seizures, confusion, coma, loss of feeling or function in muscles, problems with movement, or speech impediment. For treatment, fluids and potassium will be given through a vein. This must be done carefully. High glucose levels are treated with insulin given through a vein as well. Diabetic retinopathy may have played a role in Anna's death. This is because retinopathy causes damage to blood vessels, and she had abnormal blood vessels present on her left eye. This would have been a natural cause of death because it is a medical emergency. She also may have had blurred vision, fell, and died. Anna also may have died from diabetic nephropathy. Diabetic nephropathy, in a nutshell, is damage to the kidneys caused by diabetes. Anna's left kidney showed signs of necrosis. Necrosis is the death of most or all of the cells in an organ or tissue due to disease, injury, or failure of blood supply. Since Anna's kidney is damaged and diabetic nephropathy causes that, we can start to make the assumption she may have suffered and even died from diabetic nephropathy. The cause of death would have been natural causes as well. Anna could have also died from diabetic neuropathy. Diabetic neuropathy is caused by high blood glucose levels in the blood and urine, much like Anna has. A symptom of diabetic neuropathy that Anna shares is a tingling sensation in her hands and feet. We know this information from Anna's medical history for when she was 14 years old, so the disease could have gotten much worse near to when she died. Also, a symptom of this disease is weakness. From Anna's medical history, it shows that she was weak and had a hard time completing physical activities as well. From diabetic neuropathy, her high blood glucose levels could have damaged her nerve fibers in her heart, causing her heart to stop and killing her by natural cause. Anna could have also died from a coma due to DKA because she is a type 1 diabetic and does not produce enough insulin, which, as we explained earlier, leads to DKA. Anna also suffered from some of the symptoms of one with DKA, such as frequent urination and weakness or fatigue. Ketones were also found in her urine due to the breaking down of fat into ketones. We also found that before Anna's death, she ate a pretty sugary meal and possibly forgot to take an insulin shot and therefore could not get the glucose in her cells. This may have caused her to break down her fat for fuel, causing DKA. If she did indeed die from a DKA-induced coma, this could have been a natural cause of death. We do not know if Anna faced many of the other symptoms listed, such as abdominal pain. This provides a little evidence as for why she may have not suffered from DKA. Her medical records also do not indicate she had suffered from DKA, leading me to believe she may have not died from it. Most likely, Anna could not have died from a hypersmolar, hyperglycemic, non-ketonic coma. Anna only shares a few symptoms of this disease, such as weakness, and they are common between diabetic diseases. Most importantly, the reason that she could not have died from this disease is because it is caused by dehydration and no ketones in the body. We can see that Anna was dehydrated in her past, but not to a severe level. But we also see that there were in fact ketones in her body, showing us that she could have definitely not died from a disease that causes a lack of ketones.